Western New York at Work has been a leading force in bridging the gap between small business and the community. Originating as a radio show hosted by local leader and entrepreneur Dale Martin, Western New York at Work has covered the local events that make Buffalo the cultural hub that it is. Dale Martin and Western New York at Work have been at the forefront of sports, jobs, economic development, and always the people that make it happen. Western New York at Work continues to create new excitement and innovative paths, as seen with the addition of co-host Lauren Lewis, and of course its signature event, Partners with a Shared Vision, which is redefining the meaning of true collaboration, leadership, and making Buffalo even better. From Jefferson Avenue to the South Towns, together, we are Western New York at Work.
Good morning, Buffalo, and welcome to Western New York at Work. I'm your host, Dale Martin, and today we have another great conversation. I have with me Mr. Stan Martin, who is with Chickatelli Associates, Hope Buffalo. They're doing some amazing things throughout our community. And we're going to have a conversation with Stan to kind of find out what's the latest and greatest that's occurring, especially in the climate in which we're dealing with today. So Stan, first and foremost, welcome to Western New York at Work.
Thank you, Dale. Thank you, for inviting me. It's a pleasure to be here this morning.
So Stan, for anyone that has that's not familiar with Chickatelli Associates, kind of give us an overview of the organization and the type of work that the agency does.
Dale, CAI or Chickatelli Associates, we're based in New York City. We've been in the business for 40 years. It was founded by Barbara Chickatelli, who's our CEO, president, our fearless leader, who's still very active and, involved in the program on the day-to-day operations. So we're very, happy about that, obviously. As a vision and mission that, resonates with many of our partners who are, that I'll talk about later on. But just real quickly, our home office is based in New York City and Manhattan. Obviously, with everything that's going on with COVID-19, the office is closed and everyone's working remotely. Out of all of our offices on a national level, we have offices not just here in Buffalo and New York, but Albany, Atlanta, LA, Denver, just to name a few, and also some satellite offices internationally, which our work, Dale, is really grounded in creating opportunities for youth and community residents, stakeholders, healthcare providers, to really be a part of the solution and engage folks in the work in a real participatory manner, primarily marginalized or those communities that have some of the greatest needs.
Okay, and when you say greatest needs, give us very specific areas that you're speaking of.
Well, in particular, our hone in on the work out of the Buffalo office. We know that based upon some of the science and data that there are high smoking rates or tobacco use amongst African Americans or those who make less than $15,000 a year. So how do we educate and inform the population who are targeted to some degree about not only the harmful effects but also providing information to quit as well. And we have when you look at teen pregnancy. Their teen pregnancy rates are some of the lowest that they've ever been, and that's to the fact that we've been able to engage youth in that process. And just some of the other work out of the Buffalo office. Our REACH project is really looking at the health disparities, amongst African Americans in particular who live on the east side of Buffalo. And, those are just some of the things that we're involved in.
Well, this right off the bat, this lets me know that there's a lot for us to cover and talk about today. So let's start with teen pregnancy. You mentioned that, currently today there, the rates of teen pregnancy has dropped. What would you contribute to that success?
That's a great question. All of our work pretty much, Dale, is deeply rooted and grounded in terms of addressing the social determinants of health. So what I mean by that, let's look at, some of the root causes of poverty. So if we're able, in terms of, believe it or not, if we're able to, when we're working with youth, to not only provide them with evidence-based interventions, that, helps them to make an informed decision about their decisions around being sexually active or to delay being sexually active, or, the sexual and reproductive health services. All right, then, he or she or they are able to make informed decisions, then connect that with, a pathway to education or pathway to employment, building on our partnerships, our social capital, as we like to say, to leverage those relationships that create a healthier and brighter Buffalo and future, ultimately, for our children.
Granted, there's a wealth of information out there in the marketplace, and you mentioned about your community partners. That's great and that's understandable. However, from the lens that I look through, I'm still seeing that teenagers are still being encouraged by their peers or affected by the company that they keep. Mom and dad can provide you with a basket full of condoms. Pamphlets can be on the dinner table or kitchen table, whatever the case may be. But as soon as that young man or young lady walks out the door, they're amongst their audience, their peers. And so there's another level of influence, I think, that somehow can get in the middle. Now, that's my own personal opinion. Would you work at this every day? Would you say that there is some truth to that? Or, just what are your thoughts around just that influential thinking?
Yeah, I think, the real issue is that we have to look at ensuring whether, our children are walking out the door or even when they walk in the home, that people have access to resources and information. For example, when youth walk out that door, the work that we're trying to do through Hope Buffalo in particular, right, is to build, strengthen a community of caring adults. So you can remember, when we were growing up, Dale, as brothers, that, like if we were doing something or engaged in something, where so the neighbor or someone who knew our parents, they would pick up the phone and call and say, hey, I saw Stan doing so-and-so, jumping off the roof, and skipping roofs or, things of that nature. Yes. Or I saw Dale, skipping school or, not being where he's supposed to be, but my whole point is that, you had a community of caring adults.
Yes.
That there was no wrongdoing or missed opportunity to some degree, where so you involve parents, you make sure that every youth was cared for. And I think we have to get back to some of those basic core values to ensure that we're building a community provided environment where children have and young adolescents have the ability and access to information and to feel safe and heard. And parents also need to have that information as well, so that there's a comprehensive approach, so that there's no missed opportunities. You're bridging, you're building bridges over gaps, for lack of a better term. To address those needs.
And I think you bring up a very good point in terms of the parents. The parents have not only a responsibility, but also parents really are looking for how do they talk to their kids today, because there's a disconnect in some cases where the parent hasn't been educated. And it appears that your organization provides, whether it be training or just information on how to communicate with their teens.
Yes, there's a couple programs, one in particular, that we have that we're implementing. One in the on the west side of Buffalo. It's called Families Talking Together. When you're some parents in some cultures are definitely uncomfortable or doesn't have the information, to have this conversation with their child, with their adolescent, with their teen. So in terms of our Families Talking Together program, which is implemented by our Planned Parenthood partners, they're working with the community in terms of, or parents, to how to have that conversation, how to, share information and provide a space where there's two-way conversation and two-way dialogue taking place. In addition to that, Dale, if a parent is uncomfortable having that conversation, we're implementing a program called Raising Healthy Children, where yes, it's important that the students have this information and that teachers have the skills to have that information. But Raising Healthy Children also provides parents, with tools and access to resources to have that conversation as well. So, just really trying to meet folks, where they are and, giving them the best possibility or the best tools possible, to have an open and honest dialogue.
Okay, great.
Hi, everyone. I'm Lauren Lewis with Western New York at Work and a partner at Staff Buffalo. And I wanted to come and say hi to everyone today to talk about career tips. Now, I know we're all in a very uncertain time, and maybe you're not sure about what the future holds for you for your job. Maybe your job is set in stone, but this is a really good time since many of us are at home and working from home every day to kind of maybe do some things that you thought you wanted to do in the past when it comes to your resume, LinkedIn profile, and really kind of getting yourself ready for future opportunities. So I wanted to give you some career tips on things that you could be doing while you're home working or after work, or if you're out of a job and really kind of thinking about that next step. I wanted to give you some great tips of things you could do to make sure you're ready to take that next step. So one of the first tips you can do is update your resume. I'm sure there are many people out there that have not updated their resume in a long time. It's one of those things you think, oh, I should add that to my resume. Oh, I got a promotion. I should add that to my resume. Oh, I got an award at work. I should add that to my resume. But you never do it. We've all been there, guilty as well. Now is as good of a time as any to update your resume. Update your current job. Update your past positions. Really make sure it tells everyone what you've done in your career. Your job duties, any leadership opportunities you had, any special projects you were on, volunteer work, any awards you received, those should all be on your resume because they are a huge reflection of the accomplishments you've had throughout your career so far. Also, very important, contact information. Make sure your contact information is up to date. Make sure your phone number is correct, you have the right email address, you also have the right location. If you're looking to relocate, you want to make sure that your resume reflects the location that you're relocating to so that hiring managers don't exclude you from any positions in a certain area.
Western New York at Work is brought to you by our key business partners and many business professionals, including Bocce's Club Pizza, Staff Buffalo, Buffalo Healthy Living, CAI Global, Hope Buffalo, Embassy Suites Hotel, and 716 Limousine. You did mention that there's been some success as it relates to teen smoking. Let's switch over to another area because I believe you mentioned that. We were talking about teen pregnancy. Now let's switch over to the teen smoking component of it, because there lies another health disparity, and that same information or information needing to get out to that same population.
That's very timely, Dell. One of our projects that we have at the Buffalo office is a state-funded program called Advancing Tobacco Communities, which has a community engagement component and a youth component called Reality Check. In terms of teen smoking, we know that vaping, is on the rise right now. More adolescents are vaping, and in order to combat that, I think I want to give the governor's office, a shout out, in his recent budget that just passed the other day, whereas they're banning, flavored tobacco products, for e-cigarette. That is a tremendous accomplishment for us who are working in tobacco control. And at the same time, let me back up, because we know that flavored tobacco is utilized for a reason. When you think about adults, not too many adults are interested in bubblicious flavoring tobacco or Skittles type flavoring, marketing, and advertising. That's really targeted towards the youth population. So with the governor's bill, that's really going to restrict and ban, flavored tobacco or particularly e-cigarettes, in our area and across New York State. So kudos to his office for doing that.
That's great. That is a huge accomplishment coming, as you mentioned, from the governor's office, and hopefully in the so distant near future, we'll start to see some success.
And in terms of certainly, I hope so as well. And we know that there's still more work to do. In terms of when we look at flavored tobacco, and going back to my comment earlier about who's still smoking, we've done a great job in moving the needle, in terms of reducing the prevalence of tobacco use across this country overall. And however, in terms of advertising, going back to the flavoring, like the ban does not include menthol, menthol cigarettes. So, we still have a lot of work to do, when we look at in terms of the disparities, in terms of who's actually smoking, whether it's based upon income, whether it's based upon education, whether it's based upon, access to resources, what have you. There's still a lot of work, to do in order to continue to drive, a product when used as intended will kill you down.
So Stan, let's continue on the conversation about smoking.
Yeah, I mentioned in terms of some of the advances, and there's one initiative that we have out of our Buffalo office as well, Dale. I mentioned called REACH, the racial and ethnic approaches towards community health. So, given this day and time where we're at with the COVID-19, which we know has tremendous effects amongst those with underlying issues and in particular respiratory issues. Smoking definitely can cause make one's immune system make them more susceptible to attracting the virus. So one of the things that right now certainly encouraging people, if they smoke, to stop smoking, and if they want to quit, they should really seek out the quit line. And this is information that, in terms of when you look at who's most susceptible, those communities, the REACH that the REACH project is working in, really need to have this information. Everyone needs this information, and in particular to our work, our funded work. We're really trying to get this information, the facts, not fiction, out, to communities that are, in the 14208, 209, 211, 13, and 215 zip codes, as it relates to our REACH project.
So is REACH something that's for both parents and the teens, or just solely directed toward the teens?
REACH is a program targeted specifically for the African American community. We know that when we look at health disparities, when we look at chronic disease, that the African American community, the Black community in particular, have higher rates of chronic disease than other ethnic groups. And then when you break that down geographically, and even when you look at the county health rankings for our area, as a whole, in comparison to other counties throughout New York State, there's still a lot of work to do. There's still a lot of information and access to services that need to be shared with those populations.
Okay. There's a conversation out there, and I don't have any statistics, but I'm thinking, Stan, that there's a direct correlation between our school dropout rate and teen smoking. And in your works of life, is that accurate? Or teens that tend to...
based upon the science and the research, there's not necessarily, exclusive, to teens. However, what we know, based upon education, those who have higher education or those who have less information, smoke at higher rates than those that do. If that answers your question.
Yes. Okay. And what about, especially in today's climate, where now, schools have decided to, I will refer to it as homeschooling. Okay. So now the students are no longer actually going to their school building, but they're at home with the hopes that there's some degree of educational learning that's happening in the home. That being said, you are now somewhat removed from having that same conversation, the same important conversation with that parent or that student. I would imagine that your job is even more challenging now.
Bill, that's another excellent point. And, this is our new normal now. So this is a great opportunity for me, and it's a time to give a shout out to some of our partners who are actually, the ones who go into the schools and provide, evidence-based interventions, information to teachers, to students, and to parents. Like we have a rich partnership with the Buffalo Public Schools, Erie Bossi's, Native American Community Services, Coffee Girl Mentoring Program, Planned Parenthood, and a host of other partners who are now changing their platform from a in-person or face-to-face, educational or professional development delivery to now of a more online, due to social distancing and where we are, as a country due to COVID-19, to ensure that students, our audience, are still receiving medical accurate information, including the linkage and referral piece. So it's going to take some time. We're kind of pivoting like everyone else, and we're in transition. So the thing is, this will not only force us to look at what's happening now. How do we address these issues when it happens after, we quote unquote, go back to, what used to be the new normal, So that's definitely something that we're working on.
Okay. And Stan, you just mentioned about some of the, just a few of the community partners that you are working with. Has there been any thought to, once we get past this, are there any particular, meetings or events that are going to be occurring, whether it be virtual or otherwise?
Yes. One of the things that we've been very fortunate to do, we have monthly community action team meetings with, through Hope Buffalo, every fourth Thursday of the month. So we've now transitioned to an online format. So anyone who wants to attend those meetings, they can go to our website at www.hopebuffalo.org. They can attend, they can register and, RSVP their attendance for for those meetings, and we'll make sure that they get the link to attend virtually. And, if someone wants to find out more information about any of the topics that we've discussed, this morning, they can contact me at smartin@caiglobal.org.
Fantastic. Well, Stan, I can't thank you enough for being a part of West New York at Work and the partnership that we have and getting this most valuable information out to our teens, to community partners, and especially also the parents. Are there any areas or topics that you would like to touch on that we haven't spoke of up to this point?
That's an excellent question. I just think that, I just want to encourage, you and, your team and your audience, to, stay safe, number one, to adhere, to some of the guidelines. We are all, in this together. And, as long as we're, following those, guidelines and, recommendations, I think that collectively, we'll be okay.
Yes. You mentioned earlier in the conversation, it takes a village to raise a child. Is now it's going to really take a collective community to raise the conscious awareness of the community, and its partnerships with CAI and your other community partners that are going to be a part of making a difference.
Well, thank you. I really appreciate the opportunity to be on your show.
Okay. Enjoy the rest of your day. Thank you for your time. And again, we love the partnership with West New York at Work and CAI, and you have a great remainder to your day.
Thank you. You too.
Call Mom.
I will do.
The goal? To reduce teen pregnancy rates by 30% by the year 2020. The Hope Buffalo initiative is on a mission to make Buffalo a healthier place for teens, with a focus set on 9 zip code areas where disparity rates of teen pregnancies are almost 2.5 times the national rate.
One of our guiding principles entails us to really address the social determinants of health. Let's look at some of the root causes of poverty as opposed to looking at teen pregnancy as the root cause of poverty. And having said that, we've been able to partner with over 40 organizations from the Buffalo community to really help make this goal come true, make it a reality.
Hope Buffalo is supported by a $10 million grant over 5 years from the U.S. Department of Health and the Human Services Office of Adolescent Health. By leveraging the OAH funds, Hope Buffalo has a unique opportunity to mobilize a movement in Buffalo, focus on building an environment where youth live, learn, work, and play. The funding helps assure that teens in the Queen City have the support and resources they need that's safe and without judgment.
The areas in the Buffalo metro area that are at the highest risk of teen pregnancy. And also, these teenagers are also at a much higher risk of sexually transmitted infection. So it is vital that Hope Buffalo reaches these teenagers in order to teach them the skills they need that they're really not getting anywhere else.
With the support of the Board of Education, Hope Buffalo is able to provide access to comprehensive sexuality education in our schools.
One of the things that I particularly like about having Hope Buffalo involved in our schools is that it creates the opportunity to have a conversation and redefine the norms. What is acceptable behavior? That empowers young people, that they are in control of their decisions. And that certainly is a big issue in inner city education, making sure that peer pressure does not overpower your own personal decisions, and being aware that if you make certain decisions, the ramifications of those decisions, that ultimately you are in control of your body and your mind and your spirit.
The collaboration of strong community partners and with the financial support from OAH, Hope Buffalo has the tools to make measurable impacts in the lives of local youth, building a healthy future for teens and building a better future for our community.
Western New York at Work is brought to you by our key business partners and many business professionals, including Bocce's Club Pizza, Staff Buffalo, Buffalo Healthy Living, CAI Global, Hope Buffalo, Embassy Suites Hotel, and 716 Limousine.